Hi, my name is Gregory. Today I'm going to be performing a medical assessment. I was dispatched to a 39-year-old female complaining of shortness of breath and difficulty breathing. As I arrive on scene, I have my BSI and my scene is safe. My general impression is a female sitting in the tripod position complaining of difficulty breathing. The nature of illness would be the shortness of breath. She is my only patient, and she is sitting upright, speaking and breathing, so the C-spine is negative for precautions. She is alert and talking, which means she's moving air adequately. As I arrive on scene, I'll be like, "Hey ma'am, my name is Gregory, I'm with the ambulance, I'm here to help. What's been going on?"
Just a little short of breath.
Short of breath? Okay. With that, I'm going to assess her vitals. Her airway is patent and she's moving air, she's talking, communicating. I'm going to check her breath sounds. Okay, she has wheezing through all lobes on both sides. So I'm going to administer 15 liters of oxygen via a non-rebreather mask. I'm going to check her pulse and count respirations at the same time. Her pulse is 96. Her respirations are 24 respirations per minute. Her skin is within normal limits. It's not cold or she's not diaphoretic. So there's no shock to be treated for. We are going to transport her since she is short of breath. And I'm going to initiate my secondary assessment. So how long has this been happening?
Just the last hour.
Okay, and what was happening when it started? What were you doing?
Just watching TV.
Because you were just watching TV and it happened? What does it feel like? Can you describe it for me?
Like tightness in my chest.
Okay, just tightness in your chest. Does it just hurt in your chest or does it hurt anywhere else?
No, just in my chest.
Just in your chest? Okay, can you rate it on a scale of 1 to 10? 1 being I can breathe fine, 10 being I can't breathe at all. Where are you sitting?
An 8.
An 8? Okay. And it's only been happening for the last hour?
Correct.
Okay. Do you have any allergies?
Yes, I'm allergic to penicillin.
Penicillin? Okay. Are you on any medications?
Albuterol.
Albuterol? Okay. Any past medical history?
I have asthma.
You have asthma, so you take the albuterol for the asthma. Okay. What was the last thing you ate?
Breakfast.
Breakfast this morning?
Yes.
Okay. And you said you were just sitting on the couch watching TV when this all happened?
Yes.
Okay. With that, I've collected enough with my sample and OPQ-RST. I'm going to recheck her vitals. So I'm going to reassess her breath sounds. Okay, she still has wheezing throughout. Is that oxygen helping you breathe at all?
A little bit.
A little bit? Okay, I'm going to recheck her pulse and her respirations. Her pulse is 90 and her respirations have dropped to 20 breaths per minute. Her blood pressure is 112/70. So my field impression is she's suffering from an asthma attack. So with that, I'm going to help her in administering her albuterol through her metered-dose inhaler. I'm going to hand her off when ALS transport arrives and give my report. When ALS arrives on scene, I will tell them I have a 39-year-old female complaining of shortness of breath and difficulty breathing. Initial assessment provided that she was wheezing throughout all lobes. She was breathing at 24 breaths per minute. I gave her 15 liters of oxygen through a non-rebreather. Medical history and medications. She's allergic to penicillin. She's on albuterol for asthma. I assisted her with her inhaler therapy to hopefully eliminate the wheezing and the shortness of breath that I assume was caused through asthma attack. And her vitals presented after treatment of oxygen therapy as 90 on her pulse, 117/70 BP, and a drop of 24 to 20 breaths per minute. And With that, I'm done.